Hello everyone, I'm Mary Rose Corrigan, Public Health Specialist for the City of Dubuque with a March 24th, 2020 COVID-19 update from the Dubuque County Public Health Incident Management Team. In Iowa and around the country, cases continue to rise. For the current case count, go to the cityofdubuque.org/COVID-19 webpage and look at the map. As of today, Dubuque County has 6 cases, 1 in the 18 to 40 age group, 3 in the 41 to 60 age group, and 2 in the 61 to 80 age group. No new cases were reported for Dubuque today, but the state added additional 19 cases for a total of 124 in 30 counties. The numbers slowly creeping up in Iowa tell us that the virus is still circulating and community spread is happening. But because we don't have broad testing ability, the numbers really don't tell us much more than that. Big surges in the numbers of positives will give us more direction. Remember, our current mitigation and stay-at-home strategies are meant to slow the rise in the number of cases or flatten the curve, and not overwhelm our public health and healthcare systems. So let's talk about testing. It's a known fact that we don't have enough tests in the United States for a variety of reasons outside of our local control. The State Hygienic Lab is getting more tests for our healthcare providers every day. Also, private labs are starting to distribute more tests to clinics. But it's not like we're going to get a big surge of tests available so everyone can be tested at this time. Here's the point. If you're mildly ill with COVID-19 signs and symptoms, fever and/or cough and/or difficulty breathing with respiratory symptoms, stay at home. Isolate. Take care of yourself. If your signs and symptoms worsen, by all means contact your healthcare provider. Let's not use our healthcare workers' valuable time, their testing supplies such as the swabs, and most of all, their protective personal equipment or PPE. Let's not use these up doing unnecessary testing, because whether you test positive or not would result in the same outcome. Stay at home and isolate so your illness doesn't spread to others. I want to mention a few words on masks. We've had many inquiries regarding making homemade cloth masks. Many of you can sew and want to put your skills to good use. The Iowa Department of Public Health is creating guidance for mask making, and this should be available soon. If we do end up making our own masks, we'll want to make sure they're effective. Right now, studies indicate that regular cloth masks only contain about 5% of the virus. So we don't want to go through a lot of effort that won't do any good. Stay tuned for more information on homemade masks and how you can help. Monday evening, Mayor Roy Buell gave a statement on COVID-19 to the community. He said, "I strongly recommend that all residents voluntarily stay at home for at least 14 days in an effort to slow the spread of coronavirus. All medical evidence and data show that the only way to slow down the spread of this dangerous virus is by staying home." That's a pretty strong message. The mayor still understands that we need to go out for food, medical care, and medicine, but there are now ways to minimize these trips also by calling ahead, using delivery, etc. And many restaurants are offering discounts for pickup meals, and pharmacies are providing delivery. We also need to minimize the number of people from our home doing these errands. Finally, I just want to say I know all these sacrifices are hard. Life is difficult. This is one of the greatest truths. And once we truly understand and accept that life is difficult, then the fact that it's difficult no longer matters. We're all in this together. Thanks for watching.